he is changing schools this year. So he finished 4th grade and he will be moving to 5th grade in a brand new building as a middle schooler. And so one of the questions that I really am trying to find some more clarity before I contact the special ed administrators in my local school district. And I was waiting, I was on the webinar this morning with the commissioner and all the dignitaries, if you will, hoping to get some specific information, but nothing really. And then of course they had Brian from the special education office, who again did not come up with anything specific. So before I reach out to the State Department and to my local school district, I just wanted to talk to the parents and to you as advocates and to maybe get some more, how should I say, directed input and advice on how best to find the answers I'm looking for. So my dilemma currently is we have a multi-generational household. And so allowing my children to go to school presents a terrible health hazard for my elderly parents. And of course, for everyone in the household, but primarily the elderly in the household. And what I would like to know is if I opt to, and again, I don't know what options right now. We had a very sketchy preliminary survey from the school district in terms of our preferences. Are we planning to send our children to school? Are we planning to have them ride the buses? Or would we rather keep them home and allow them to do online schooling? I'm also open to a possibility, if none of this, of course, online schooling is not possible, to completely withdraw my son from school and homeschool him for a certain duration of time until we know that it's safe to go back to school. But my question is, if we decide to keep my son home, at least for the fall, how will that impact his IEP and services? And is this a decision that is guided by some federal and state guidelines, or is this a decision that the local school district will have to weigh on? And then what if I have the option to keep him home for the fall, and then at some point decide to allow him to go back, let's say in the spring? Again, how is that going to impact his services? If I decide to homeschool him for 1 year, will that automatically, withdrawing him from the school district, discontinue his status in IEP? And then when he goes back, what is going to happen? Do we have to go through a whole new evaluation and, services, planning, all of that? Am I making sense?
Mm-hmm. You're making a lot of sense, and you're asking questions that a lot of parents have. And go ahead, Lisa, you go first, and then I'll fill in.
So what's interesting about this is
it's a loaded question, Eva. It's a loaded question.
Huge question.
I'm losing sleep over it because
we all are. Yeah. Yeah.
I don't know. I don't know if not allowing him to receive services will impact him in a more negative way in the long run versus, the health benefits of keeping him home or the health risks of allowing him to go to school.
So school districts are expected to come up with a number of different plans that they're offering to schools. The only thing is that it's up to the districts. So no two districts are going to be exactly alike. What the guidelines have said is that they expect there to be one hybrid, which is kind of a little bit in school and a little bit outside of school. Can you plug that in for me, please? The other is complete distance learning, like we did when we were in the shutdown originally. And then the third option is for them to be able to maintain, to get instruction in the classroom. Now, the problem is that we come across that where, how do we know what our services are going to look like if we choose to be doing distance learning. And that's what I think you're talking about. There's a difference between distance learning and homeschool. So distance learning is where you are doing the curriculum that's provided by the district, and homeschool is typically referred to where you've completely withdrawn your child from school. And then that kind of is a much bigger thing to do, only because then you have to go in for reevaluations once you choose to re-register your child. If that's correct, what they're saying now. So as far as his IEP, they still have to try their best to accommodate his needs, make modifications. Anything that's on his IEP really should be able to be done virtually. There's some that are easier than others, though. So if he has services, speech services, we're fairly successful for students for virtual. PT and OT are a little bit harder because it's all hands-on activities. But as a parent, you're going to be able to choose. Do I choose to send my child to school full-time? Do I choose to do the hybrid model, which is a little bit in school and a little bit at home distance learning? Or am I going to do 100% distance learning? So it's really what your comfort level is, I think. But the school is still responsible. As long as your child is registered and has an IEP, then they still have to they still have to be working towards those goals and objectives as best as they can. There are some that are going to be easier to focus on through distance learning than others. Is that a good start? It's a really, it's a hot topic. I mean, I was originally just going to pull my two, I have 4, but my twins are starting kindergarten and one of them has a pretty big IEP. And I was originally going to pull him until I realized I would be giving up transition services at the end of his academic career. So we are also in the very similar situation where we don't live, or my parents live very close, and my mom is in treatments for cancer. So we're very cautious about, we have not left quarantine yet. We're still very much doing very strict. We're not seeing any friends, anything like that. So for us, it's a big deal, and we're struggling to make that decision just like you are, because what's appropriate for my children might not be appropriate for our family overall. And so it's definitely something that we have to look at and see. We have to really weigh out the risks, like is an IEP being done the best in school outweigh the possibility of getting someone sick? And that's where the worry comes in. That's where one of the things where you stay up at night, like, what do I do? And I think there's parents going to be saying that to themselves and asking themselves that until the first day of school, or until the second day or third day. I think it's something that's not going to make us feel any better necessarily. What is your gut telling you to do?
Well, first of all, from what I understand and from what I heard this morning and over again, is that the school district, and I heard this from several school districts, from the superintendents, and as well as from the commissioner, is that it's either plan 1, 2, or 3, meaning that if the school district goes with in person, then there is no hybrid. Hybrid is a phase that will be possibly gotten to if needed, exactly, and along with that distance learning, online learning as phase 3. However, what I think I'm going to do is, and again, I don't know if my school district, and I don't know how to find out earlier enough if my school district will allow, and again, the state has not, they talk about this, but there's no clear language that the state allows, and the local school district should follow suit and should oblige with the recommendation that parents should have the option to keep their children home and go with online learning without having to withdraw their children from the school district. So if my school district offers that option, then that is what I'm going to do. And, you know, maintain as best as we can and receive as best as we can his services. But my concern is, what if the local school district says, okay, we only offer in-person school in the fall, and that's it for you guys? So then I have to completely, again, do I have the option to say, no, I want online schooling for my son, and on what, based on what grounds? Does his IEP have any weight and say into that choice that we make as a family?
Mm-hmm.
I also am concerned that given his, you know, range of disabilities and issues, that, you know, in person, in the situation that we're in, and he's very much aware of what's happening, is not going to be a positive support for him. I mean, he's not going to feel safe and comfortable and relaxed. On the contrary, I think his anxieties and his, you know, his issues are going to be worsened if I were to send him to school on a bus with a mask, you know, having to follow all these specific.
Yeah.
So I just don't know how to find out, and how to find out early enough if the school districts will definitely, based on state recommendations, allow on the parents to choose online school or not. Because clearly we were told that it's either 1, 2, or 3. And most likely we're going with in-person, you know, all students.
From what I understand, and Leona, correct me if I'm wrong, I was under the impression that all schools had to offer distance learning as an alternative, even if they choose to open in person. Because it is such a hot topic of comfort level, I believe schools are expected to offer some sort of distance learning without repercussion of, you know, then your child, it's either all or nothing. From what I understand and from what we've read is that the schools do have to offer both options. So if they are planning to open, they also have to be planning to offer some sort of distance learning for those families like yourself that don't feel comfortable going back but still want their child to be addressing their IEP and participating actively in school. I think that they're going to have to respect that at this point. Leona, is that how you're hearing it as well?
So my understanding is that it has to be an option, but who it's open to, that seems to be unclear.
Yeah.
So, and I'm just going to use, you know, another district where going back to school, we already know they're going back to school face-to-face, and that is the only option, except for a case-by-case basis for virtual learning. So, and then, but I would assume that the case-by-case basis would be like if the student is at high risk or the household is at high risk. Yeah. But again, it's not really clear. But you know, that's probably the strictest thing that I've seen so far, is that particular one. But more than one option is offered. It's just a matter of who, you know, who's going to fall into that other category. That seems to be the issue, but that's still really unclear because when you read the documents, it says virtual needs to be an option.
So what about if she chooses the virtual, possibly if it's only offered to a handful of students, then that might be something that you could talk about at an IEP meeting and saying, listen, due to anxiety, this would be the best route for my son, for him to be as successful as possible. That could be something to talk about at a PPT. And that's where that IEP is going to come into play and really help in that sense, I think.
And I think it's important too that when you have an IEP, or if you have the IEP and you're going to have a PPT meeting to discuss these things, is you're also looking at what kind of services are you getting at home, and you know, what kind of services would you get in person, and are you okay with, you know, how it might have to be accommodated. I think that I think some families would be okay with that, like, you know, I don't want to use the word reduced, but I'm going to, but almost reduced services because it is virtual, as long as we're accommodating all of their needs that we can in a reasonable fashion. So I think for each family, it has to play out very individually, but with each district being able to do things differently, this is definitely going to be a time of uncertainty.
Yeah.
You know.
So what would you suggest as the best strategy to begin to look for answers from my local school district? Should I, because nothing is coming. It is very much after that initial survey, we haven't heard anything. The district, I'm reading from the local newspaper. It's not coming from the district, but the local newspaper is, publishing articles that the district is spending close to $300,000 to purchase computers, Chromebooks, just to be ready, just in case for the fall. But I haven't heard anything from any of the special education administrators or the level administrators. His PPT that was supposed to be scheduled and held at the end of the year in preparation for transition to middle school. Nobody contacted me. There was no communication. I spoke to his case manager who told me, well, we're not holding PPTs at this time, although I think that, online PPTs are perfectly fine. Maybe you should consider requesting one when he starts 5th grade. So it's all very vague and muddy, and I just want to find answers. I don't know if I should contact the superintendent directly, if I should go through the level administrator, should I go to the school principal, should I email all of them, should I request, a virtual meeting to hopefully look for answers and explore options?
So the guidance that was released from the state was that districts are able to hold PPTs if the family and the school deem it necessary. And I think at this point, I would deem that kind of necessary to get the conversation started, to have open communication about your concerns and seeing what possible opportunities they're going to have available to him. But I would start with, emails in, maybe requesting a PPT. I think that many districts are holding PPTs. The only ones that are a little bit harder are ones that evaluations were not completed. But if it's your annual PPT to talk about transitioning to the middle school, I think you could probably hold that as long as you don't have to look at evaluations. And you can request that, and that's your right as a parent. And the COVID guidance has not said that PPTs are not to be happening.
Right.
So you still have the right to call a PPT. And if that's what you feel is going to be best, then I would start there. I would say, I understand it's my right as a parent, even during this time of COVID, to request a PPT. I'd like to talk about options for the fall.
And I would follow up on whoever sent the survey. So who did the survey come from? I would follow up and say, do we have the results and the plans for our district? So perhaps it is the superintendent right now, just to ask for the overview plan of if they know what it is for the district. And then you can take that plan and work with the director of special education or whatever their title might be in your district, and work on what, is best for your son.
Yeah.
Okay.
But I would start probably to say, what is overall plan for the district? So then we can take that plan and work it into what's best for my student.
And I think most districts right now are going to say, oh, we're working on it. But by, July 24th?
Mm-hmm.
All of them have to have their plans turned into the state. So the closer we get to that, the better idea that they're going to have for what options they're going to be offering.
So know that too. I think in part, like, we have to just be just a little bit more patient. It's really hard. School's going to open before we know it. So, we want answers. Anybody else have anything to add or questions, or what are your biggest concerns right now? This is definitely one of the hot topics that's going on.
I think the part that's so hard about it is that there's just so many unknowns. There's so many unknowns with this virus, and now it's impacted us for so long at this point about our daily lives, and it's still impacting us. And I said to my husband just last night, I was so frustrated because I said, I feel like there's no end. There's no end in sight, and there's so many unanswered questions. And once you feel like you get even a little bit of a question, and Eva, I think that you'll probably agree with me on this. The second you feel like you might have a little bit of a better understanding about something, you have 10 more questions that go along with it. So I think with the guidance being released about, you know, having 3 different options prepared and ready to go, I think that gives us like, okay, so those are the 3 different options. Now let's talk more about those. So getting the little bit of information is kind of like breadcrumbs. We want the whole, like the whole information, as much information about it as possible. And I don't think they're able to give it to us just yet.
Yes.
And it's super frustrating.
Yeah, I just don't want to, you know, make a decision that will potentially jeopardize his services and his, you know, long-term schooling, if you will, in the district. And again, this is something that I'm not sure if this is, again, will be rather left to the district to take care of and make decisions on, or whether the state office of, you know, special education will have some say in terms of, you know, parents. And I will assume that most of the parents, I mean, I already heard from neighboring school districts that parents, if they're not given the option, majority of the parents will pull kids out and just homeschool them if they're not given the option to choose and opt for online education, or if, you know, the child is, or the case is not approved or does not qualify for online education. But I know the district that we are in, and I know for a fact that there's nothing they can do to provide safety and distancing and really ensure the safety not only of the students, but of the staff.
Yeah, I mean, I think that, you know, everyone's saying, oh, we just have to social distance kids. But when you are in a bigger district where the classes are at max capacity, it's very difficult to figure out how to even begin social distancing. So, yeah.
And in small districts with not a lot of schools, like, where are you going to put the kids?
Yeah. Like, literally, there's not enough buildings to fully social distance.
Okay.
Yeah.
Well, thank you so much. This was extremely helpful, and it was good to you know, hear your thoughts and your suggestions. I will definitely continue to follow the meetings. And
yeah, I would just follow up with your school district, open communication, just as long as you're putting it out there and saying, hey, just checking in to see what the school year might look like, and just sending an email every now and then.
Right. And, you know, you want to follow up, but you want to have patience. They're doing everything the best that they can. And, you know, it's all of this is a big change for everybody. And then as we look at it from our students and others with disabilities, special needs, it doesn't matter if it's a learning disability, a medical need. All of those students need to be looked at individually and say, okay, what do we need? How are we going to accomplish these things? You know, I look at it too. I think about, I have a son who's the poor thing, because he's probably tired of me calling him out, but how is chronic absenteeism going to affect a student when you got to stay in the same cohorts and you can only be in the halls at a certain time? Like, I'm like, if he misses the bus, or if he misses the bell, you know, I can only bring him at certain times now, or is he still able to go whenever? How are they going to filter through? How are they going to do all this? I really don't know. But I think we're all thinking about it nonstop. And, you know, again, sometimes, you know, multiple kids, some we think they're going to go in and be fine, and others are like, I don't see that one going back quite just yet. So we have
4, I know which one has to go back. I know which one is going to be very nervous going. 2 of them will be very nervous going back, and 1 of them will not care either way.
Yeah.
So, like, trying to figure out what their comfort level is, what my comfort level is, what our comfort level is as a family. We know that for 1 of our children, distance learning did not work. The other 3, it was okay. But what am I willing to give up there? And that's where we're struggling.
yes.
I think about that too. I think about where it didn't work and where it could have, or maybe it would under different changes. But I know districts also have to have a plan for if we went back into pandemic and quarantine, and to have better virtual plans than they had, you know, actual learning plans versus learning opportunities. So, you know, the districts are very busy this summer. They're probably more busy than they've ever been.
Yeah.
Over the summers, with less staff, right? Because it's just administration that's really, you know, there right now. So I think that they're all working really hard, and Board of Eds are definitely meeting more often than.
There's a lot of teachers volunteering their time this summer as well to try
having different lessons plans and looking into things. So, you know, I do want to give a shout out to them because they really are trying right now. But
we're in a hard place, and that's where all of our educators are in between it, because there is
absolutely
no one answer to this, and there's no answer that's going to make everyone happy.
But as we go ahead, Eva, I'm sorry.
No, I said I cannot agree more.
Yeah, and as we get closer, you know, we'll hopefully have more answers. And as we start to hear from districts, and some people have heard from their districts, and some people haven't. Some districts are having forums. I was on a meeting yesterday where 2 districts are having parent forums in a virtual format to hear from the families, to see, like, what are your biggest obstacles? Would you consider returning your kids to school? What would prevent you, from doing so?
Yeah.
And I think that's really good. I love my district, but I wasn't given a say. So we did get a letter with, you know, this is what we're looking at, and this is, you know, we'll give you more information later, but, you know, pretty set guidelines, like we kind of know what's going to happen. And
we had a survey. That's all we got. I think we got probably something similar to what Eva got. And it was, you know, would you send your kids back to school? Another question was, would you put them on the bus?
We did get the bus question. We did say, would you consider?
And I'm fine driving everybody. That's fine.
Yeah.
That's an easy one I could answer. I'm fine driving everyone.
I would too, if like all of my kids actually went to school at the same time. Really got to get my oldest to get his license. This is going to be it. I'm like,
this COVID's going to be the push. The push.
Yeah, this is it. But with that being said, you know, I think it's a lot, and it's a lot to look at. And I do think a lot of parents, if they're able to, will drive their kids to school next year, which would cut down on the bus for the parents who really can't drive their kids and, you know, do that. The other thing too that I was going to say as we kind of go through this process is the plans are going to change too. Like a district might say, you know, this is what's going to work, but it might be something else. So it's really still a work in process. And we'll just keep having the conversations, and hopefully the state, you know, they'll clarify questions as they come up. I know we've had a handful of questions that we're hoping we'll get clarification on as the process goes on. So does anybody have anything else that they want to either add to this conversation? Feel free to unmute yourself, or you can ask in the chat, or you can ask on Facebook Live. Oh, there is Facebook.
I want to try something.
Go ahead, Phyllis.
I was thinking, like, this is my own idea, own opinion, my own thoughts. If they want to send their kids to school, then want to home, they can have some type of computer in the classroom. Kids that at home can still participate, but from the distant learning way. I mean, you know, everybody can still be active. I don't know. Just a thought.
I've heard a lot of people talk about something similar, saying, you know, if they had, I think that's a technology thing. I think that people were saying, you know, if some people are comfortable sending their children, to let them. And if others are uncomfortable, we can kind of live stream it.
Yeah.
And I've heard a couple of people say that just the financial piece of that would be huge, but it's always an option. We don't know.
Yeah. I mean,
it reminds me of like those shows with like the computer and the head walking around on it. That would be.
It's not like a financial burden anyway, because they got to constantly keep the school clean. So either way, it's like they're going to be in a financial burden. You know, I don't know.
I feel like everyone's in a financial burden.
Yeah.
Just from Facebook, I just kind of want to include our Facebook viewers out there. So it says, Terry says, will students with sensory needs be able to wear a hat with a visor instead of a mask? My daughter has outright said she will not go back to school if she has to wear a mask, but she really needs to be in school. So I feel like that's a very common question we're hearing right now. And again, it is district specific, but I do believe that a shield is, I mean, it's probably more comfortable than the mask. I wear the mask and I feel like I have 2 kids with glasses. Well, one has contacts, but every time they breathe in, then they breathe out and their glasses get all fogged. And then depending on what the mask is, some of those masks, like you breathe and it like goes into your nose. So I get they're not really the most comfortable thing. And I only have to wear it to run out to the store. We're going to ask these kids to wear it for like 8 hours or 6 hours or, that's a long time. So I think it's again, and if your child's on an IEP or has accommodations, they have a 504, I would get it written in to your plan. Because if it's sensory needs, this is an accommodation they need. So just to make sure that they have the choice, the student has the choice of, the visor with the mask versus just the mask. But again, you just have to make sure it fits the protocol of whatever the school is requiring, which is the CDC recommendations for the most part, and those clear visors are acceptable. Lisa, do you know you're muted?
Yes.
Yeah. Okay. She's talking to her family. That's okay. Just want to make sure it wasn't us.
Yeah. So for Milo is my 5-year-old with autism. So he went to a doctor's appointment yesterday morning and wore a mask the entire time from start to finish, which was amazing. He's 5 years old. But I am going to write it in his IEP that if it is something that becomes a behavior or a trigger or something similar, that's going to be something that could be just kind of taken off, and that's how he's going to do the rest of his day. So we're not going to push the issue, and it's not going to become something bigger or something that can trigger it for, give me a second. Okay, give me a second. Sorry, there's dolls coming at me. Writing into his IEP that this accommodation is, we're going to wear it when we can, but he's not going to wear it when he can't. And with autism and Milo, it could definitely be something that becomes a behavior trigger and kind of a power struggle with him. And that is something that I'm not willing to kind of have happen, because it could be made into a much bigger problem than it needs to be. So that's what our plan is, to write an amendment of accommodations in there.
So more questions. So a comment first, and then Melissa has a comment and a question. So Melissa's been on with us before. She is the Down Syndrome Association Literacy Coordinator. And she says she hopes that every district makes the right decision with parent and science-based perspective. And that's absolutely, we need them to do that across the board, not just this. But she followed up with, would a child's LRE be dependent on a child's ability to wear a mask? So would their least restrictive environment be dependent on whether they can wear a mask? And that's something to consider. So that's probably one of the things that could be on a case-by-case basis. I get questions all the time that say, I don't understand why somebody can't wear a mask. And every time I hear somebody say that and they're like, I want, reasons, like what are the actual reasons? Why don't we just put ourselves in somebody else's shoes sometimes? There's a lot of reasons that people might not be able to wear a mask. And, it could be because of a sensory need. It could be because of asthma. It could be for a panic disorder. I mean, there's a lot of reasons out there not to necessarily be able to keep that mask on all day. And I think we have to be respectful to the fact that not everyone, including teachers and staff, are going to be able to go 7 or 8 hours. They definitely didn't get into this thinking they were going to be wearing masks all day. Our medical professional does it, and we look at what they're, the
faces look like.
Yeah, well, thank you. And you know, and how they're sore and the sores and the ears and the face. So, you know, how are we making sure that our kids and the staff in our school don't have the same issues? And when are they getting a break? And I heard the other day, and I thought this was really great, but not every district can necessarily do this. But what if, like, at the elementary or the middle school level, they were able to do those, like, kind of surrounding things at every desk. Yes, but the clear ones, you know, but not every school's, not every, like the grocery store, exactly, but not every school is going to be able to do that. But at least when they're sitting down, they wouldn't have to wear that mask and they would get a break from it. And, you know, but there's a lot more to it too. Like, and I think I brought this up last time or somewhere, but, you know, when, like, let's say, for example, if a teacher has a student in the class that has a hearing difference, like, how can we make sure that that student can get everything that's going on? How do they have access to the education? The mask is going to cover some of that sound and the student sound. So there's just so much to consider. And it's, you know, I think everyone's going to be coming out with an overall plan, and then all of these little bumps in the road for everyone's district, because they're different, are going to come out, and then they're going to start adjusting from that initial framework. So it's just really important that once you see it, if you have feedback to give, that you give it in the most positive manner that you can and try to work toward a plan. But for what they're least restrictive, to go back to the least restrictive environment question, would be that if a child really couldn't wear it in school and the school is demanding it, then their least restrictive environment might be the virtual setting.
Yeah.
So.
And Amy also asked, some districts are not setting up PPTs to have the IEP updated. So how do we work around that?
So that's it. You know, it's really sending an email and requesting the PPT. At this point, districts should be having them. I know we're during the summer and this is not typically when they would have them, but if they really didn't have them during the school year, I would unfortunately be pushing, not unfortunately, but I would be pushing for them to start having those conversations. There are people on staff that can make this happen, or perhaps your meeting's going to happen right in September when school starts. But it's really important to start having some of these conversations. So if you didn't have a meeting and you needed to, what do you really need to accomplish by September would be the first thought that goes through my head.
If it's as simple as putting accommodations and modifications, or accommodations in for mask wearing, that could be something that could be discussed virtually just between a small team and written in as an amendment.
Yep.
And then amendment has to be agreed on between the family and the school. And then it's just pretty much updating the IEP and getting a copy of the updated IEP. So that would be one way that you could do that as well. If you can't call a full PPT, you can call a PPT to discuss the amendment of a mask accommodation.
And I think that, and I'll go back to Amy's where she says, and I'm going to assume that she didn't have her annual.
Right.
So there was nothing at the end of the year. And at that point, that's when I would consider, you know, is it better to wait till the new team's involved? Are you okay with the IEP continuing as is until the fall and you get accommodated? That question might be different for everybody, because some people might be like, you know what, it was perfectly fine. I prefer to wait till the new team is together and then have a meeting as soon as possible. But the reality is, I don't see the schools inviting us in to the school in September. So these meetings are probably still going to be having virtually for a very long time. So we should definitely start talking about it and see what we can do. But really, I think that, again, is a very individualized discussion for the PPT. But if you really need to have it, if you're going into the school year, if it's like maybe a transition year, and you don't have like what the transition plan is, like how are they getting used to the school? How are we, for example, I'll say when my son went to middle school, we had to go in. We went at the end of school a couple of times. We had to go in early before school started because he couldn't read like the names on the doors and stuff. So we had to memorize his route through the school, and we had different ways to do it. That's not something I could have waited until October for. Too late. He would have been lost by then. So that's what, it's just an example of, you know, is it something that, you know, we can do, it needs to be done now, we need to have a plan in place, or is it a matter of you might benefit for waiting for the new team?
I mean, Amy had said that
to ask for one.
Amy said the follow-up with, she had lots of contact during distance learning, but they did not have the annual, and the mask issue was never discussed.
And I don't think the mask issue we knew was going to be an issue. We were hoping it wasn't going to be an issue. Now we know.
Now we know.
This is what we're going to have to. And this is where I'd revert back to what you said, Lisa, where this is a great example of where maybe an accommodation, you know, it can just, an amendment can be done to be added, but you didn't have your annual. So it's kind of a combination of everything we said. Yeah. You know, maybe for now it's an amendment to include what mask wearing would look like for your child. And then would you benefit from holding off to the annual until the school year gets started? Because you might have, with how school's going back into session, you might have different concerns or needs that you don't know right now, or maybe you wouldn't even have known in May.
Yeah.
So, but again, this is a very personalized decision. If you say, I really feel like I don't feel comfortable going into the school year, then call a PPT. Yeah. You can do that.
If there's that thing in your gut that's saying this, I'm uncomfortable, I'm too unsure. And again, as we get closer, as we get more answers from the districts, if you're still having that feeling, then I would call it. We had a triannual that we pushed off until September in our family. And we also wrote an accommodation in. During this time.
So we had our annual, we held off on our triannual because we didn't have the evaluations, but we've had to make accommodations along the way for things because we just didn't know what the plan was going to look like. You know, so I think everybody has to. Now I did see one, I'm going to go back. Distance learning, Grace, distance learning is not working for all kids. And that doesn't matter whether they're in special education or not. It's not working for all kids across the board. It's one of these things, I think, Lisa, and you'll say it the way that you say it because it always comes out better. But it's, you know, our kids have never fit into a box. So we've been used to this, like having to find a way. This is what special education and special needs parents is all about. Like we've always been like, our kids don't fit into a box. Well, now all of a sudden school isn't the box that it was. And the kids who did fit, there's a lot of kids that are struggling and having a hard time with it. And, you know, we're seeing other kids who didn't do well in school who are like, doing extremely well in virtual learning. So it definitely showed how there are different ways and methods to engage kids and things like that. And I think it's a huge learning curve for, I mean, so many times. Here's probably one of the number one things that I've heard during this time is the district is doing for me what they told me they couldn't do. And it was because we were thinking, everybody was thinking outside of the box, like we're collaborating and thinking, how can we engage? How can we do this? How can we do that? So many cases where that happens. So it's definitely a struggle, and virtual learning didn't help everybody. So a lot of families are very excited about going back to school. And I think everybody really wants their children to go back to school, but some have to worry about safety and health. And we want everyone to be safe and healthy.
True.
So Terry, we had our PPT on January 27th, and I'm struggling still with trying to see my daughter's placement. According to my district, they did her testing, but never told me. They only got back to me when I told them they weren't in compliance and we were past the 45-day mark. This is my biggest fear right now because we don't have an IEP and no one knows anything.
Terry, was
Terry,
that an initial for special education?
that would have been, it sounds like it's her initial. And so Terry, what I would actually recommend, because is to call our office.
Yeah, because that's very
And-
specific, and we'd be happy to talk you through a plan for that.
Absolutely. And we want to, we want to make sure that in your case, we want to make sure that they're going back to school with a plan in place. Like, we want to see the evaluations.
Yeah.
If the evaluations were completed, then a plan should be in place. Like,
yeah, if the evaluations were completed, Terry had just written that she had already been removed from special education. So this was kind of reevaluating, I'm assuming. So yeah, so I think that you have if the evaluations were completed, then you should be able to move forward with an IEP as long as eligibility was determined. So I think that's, if you give us a call at the office, I'm going to write our office number into the Facebook so that you can give us a call.
Okay, so for you, Terry, give us a call. Let us help you out. We'll be happy to do so. And thank you for sharing with us, and Amy as well. So as we start to wrap up from today, we really want to say, does anybody have any last questions? This was such great conversation. We really appreciate it. And we know that this is a conversation that we're probably going to be having for most of the summer.
Yeah.
Right. Lisa and I actually we talked about it earlier today. Like, this is why we want to continue to have these talks right now. We know that it's going to be a changing target and questions are constantly going to come up. And so we're here. That's what we're here for. We might not have the answers, but if we hear what you're saying, we do gather this information up and we share it where we can to try to get answers for you. So thank you for being honest.
Logical, like, what would I do in that situation? This is where I might go, because sometimes it's just hearing from a different parent or a parent that kind of gets it, which is what's the beautiful thing about CPAC, is that we're all parents of children with special needs and diverse learning children. So
which means that we're going through all the exact same emotions as everybody else right now.
I might have cried to my husband about it last night.
Yeah.
I did. So we get it. It's the unanswered questions are really unsettling at this point. I'm hoping with each passing week we get closer to where it's going to be, and closer to comfort levels, and yeah.
Hi.
Oh, go ahead.
Hi, I would like to add something. Thank you very much. I do appreciate this meeting. It's very helpful.
Good.
I have my daughter, she's going to third grade, which is when you say that distance learning is not working for all children, I do understand it. I believe that is true because here at home, I was able to work very well. My daughter did very well with the curriculum. But in the other hand, I have the opportunity to talk to some of my neighbors that they did struggle the whole time. Like when you say the diverse learning,
Yeah.
The language barrier, parents not understanding the curriculum. I was fortunate because I used to work with the public school as a tutor. So I was able to work with my daughter very, easily, and then I understand the curriculum. But when you said that, it did really open my mind because I have talked to some of my neighbors. They were crying at the end of the school year. They could not help the children. And then I asked them, why you did not ask me? I guess they were afraid to reach out to, we know the COVID, when we were in March, April, people were not gathering together. So, and then I told them, next time that I'm here, knock at my door or ask me, I can explain to you. But it did really, broke my heart that when I was able to help my daughter, but in the other hand, next to me, there was this parent that crying and she did not know what to do. So I do appreciate you guys, you work in your company. Thank you very much. I do appreciate this meeting. and I'm looking forward to, log in and every week and, learn a little bit more about it.
Excellent. We were happy to have you.
We are. Thank you so much for joining us. We appreciate it. And we really appreciate you guys sharing your stories and concerns because it helps direct our work.
Yeah.
So
Leona and I always talk about, okay, so what could we go look up and try to find some answers to? Because that's what drives us, to try to help families as much as possible.
So we have coming up in the next week, next Tuesday, will be, Amy's not with us today, but we'll have a speech pathologist here. She's going to talk about how you can take some of maybe the goals that you had for speech and turn them into summer fun. So things you can do at the beach or in your backyard or just enjoy speech goals. And we really appreciate her doing that. And then next Thursday, again, is Lisa and I that will sit here and have this conversation with you about whatever you feel the hot topics of the week are. Who knows what guidance will come out? We might be having a totally different conversation. Yeah. And then later in the month, we know one of the things that's definitely been a topic is transition. And so we are, there is going to be a two-part transition session coming up on our Tuesdays, the last 2 Tuesdays in July. We have our Spanish support calls. They're currently Monday, Wednesday, and Friday, but during the summer, we're going to cut back a little bit and probably do it about once a week, just like we do the English version. And we have a Next Step Leadership, which this training, they're already both in process for English and Spanish, but just so that you know what we have to offer. Lucy, you want to talk about what Next Steps is?
So Next Steps is, I always refer to it as kind of special education 101 for parents, how to know what your role is at the PPT table, how to understand goals and objectives, how to talk about your child's present levels, and really being able to look at an IEP and read it, and really teaching families how to advocate for their children the best possible. And it's a great 8-week program that we normally offer in only fall and spring. And the bonus of COVID is that we've been able to offer it virtually. So we are on week 4 or 5 of our current English one, week 1 of our Spanish. Get out of here, you.
Mini-me.
There's one of my twins. And then we're hoping to do another virtual in the fall as well. Possibly, if we can do in person come spring, that'd be great. But I think we'll have a couple of virtual Next Steps in there. And it's a great way to just really learn your law, talk to other families, and kind of form these relationships and gain an understanding of the special education programs.
And so and it's being offered, like I said, we do offer it in Spanish as well. Both are currently underway, but we want you to know what things are out there for CPAC and the other types of work that we do. We also offer trainings to districts with both faculty and with staff and parents, and we're going to continue to do this work and bring trainings out there. So if you're part of a group that would like to have us come and maybe present on a specific topic, we would love to talk to you and we can talk about different topics. And then for August, we're going to start talking about maybe turning our Tuesday trainings into some of those mini trainings that we offer. So we'll also look to you guys to tell us what you're really interested in. So over the next couple of weeks, we're going to be asking you guys for a little kind of list. What do you think you would like? But we really do, excuse me, we really do appreciate all their feedback and everything that we have to offer. So we thank you for being the support, the kind of drive behind everything that we do. And we look forward to seeing you next week. We hope everybody has a really good weekend.
Thank you.
Thank you so much.
Have a great weekend, guys. Bye.
Have a good week. Thank you. Bye-bye.
Bye.
Thank you.
Bye-bye.
Bye. I think we're still live on Facebook.
Let's stop. Just realized, I'm like, oh.